Have you ever noticed how easy it is to grab a bottle of pain relievers off the shelf at the drugstore and assume they must be safe just because they don't require a prescription? The truth is, over-the-counter painkillers are some of the most widely used medications among older adults. Yet many people don't realize that these common pills can carry risks, especially as we age. What feels like a simple solution for arthritis aches, back pain, or headaches can sometimes lead to unexpected side effects that impact your liver, kidneys, heart, or even brain health. Today, we're going to explore the most common painkillers you'll find at the pharmacy: acetaminophen, ibuprofen, naproxen, aspirin, and even some topical creams and natural alternatives. By the end, you'll have a clear understanding of which ones are safest, which ones require caution, and what strategies you can use to manage pain without putting your health at risk. And if you're new here, welcome to Calm Health Hub. If you enjoy learning about healthy aging, natural remedies, and science-backed ways to protect your vitality, I'd love for you to subscribe. That way you'll never miss future videos that support your energy, circulation, brain health, and overall well-being. Let's begin with the most familiar option, acetaminophen. Also known by the brand name Tylenol, acetaminophen is one of the most common medications for fever and mild pain. Interestingly, it works mainly in the brain rather than throughout the body. That's one reason it's considered different from other painkillers like ibuprofen or naproxen. At the right dose, acetaminophen is usually very safe, even for seniors. Most experts recommend keeping daily use below 3,000 milligrams if you're taking it regularly, though the FDA sets a maximum at 4,000. Why the caution? Because your liver is responsible for processing acetaminophen, and too much over time can strain this vital organ. Think of your liver like a hard-working filter. When it's asked to strain too many particles, day after day, it can become clogged or overburdened. That's what happens when acetaminophen is taken at high doses or combined with alcohol, liver disease, or other medications that also tax the liver. Have you ever taken a cold or flu remedy and then later reached for Tylenol without realizing they both contain acetaminophen? That's a common way people accidentally exceed the safe limit. Cold remedies like NyQuil, Theraflu, or prescription pain medications such as Vicodin often hide acetaminophen inside. Always check the labels, especially if you're already taking something for pain. Now, acetaminophen is great for fever and helpful for mild pain. But here's the limitation. It isn't an anti-inflammatory. So if your pain is rooted in inflammation, such as arthritis swelling, it might feel less effective. Some people even say, Tylenol doesn't really touch my arthritis pain. That's where another class of medications comes in: NSAIDs. NSAIDs, short for nonsteroidal anti-inflammatory drugs, include ibuprofen, Advil, Motrin, and naproxen, Aleve, naproxen. These drugs actually reduce inflammation, making them stronger pain relievers for many people. They can feel like a miracle after a flare-up of joint pain or muscle soreness. But here's the catch. NSAIDs come with a long list of side effects that become more dangerous as we get older. For one, NSAIDs affect the protective lining of your stomach and intestines. Imagine removing the cushion from a chair. Suddenly, you feel every bump and scrape. That's what happens inside the digestive tract, which can lead to stomach pain or even bleeding ulcers. In fact, studies show thousands of hospitalizations and deaths each year are linked to NSAID use. NSAIDs also impact kidney function and blood pressure. They can cause your blood vessels to constrict slightly, reducing kidney performance and sometimes raising blood pressure. For seniors already managing heart disease, kidney disease, or high blood pressure, this adds extra strain. And that's not all. NSAIDs can increase the risk of fluid retention, swelling in the legs, and even cardiovascular events like heart attacks or strokes. I once heard a story about a man in his 70s who was prescribed NSAIDs for shoulder arthritis. No one warned him about the risks. After a few months of daily use, he ended up in a hospital with a serious intestinal bleed. Unfortunately, this isn't rare. So what does this mean? For short-term relief, maybe after a sprain or a flare-up, ibuprofen or naproxen can be helpful. But for daily, ongoing pain, they are risky choices for older adults. That's why the American Geriatric Society advises against routine use of oral NSAIDs for chronic pain. Here's a safer twist though, topical NSAIDs. Diclofenac gel, once prescription only, is now available over the counter. Applied directly to the skin, it delivers relief to the targeted area without flooding the entire body. Imagine watering just the roots of a plant instead of drenching the whole garden. This focused approach reduces side effects dramatically. So, if you're weighing the choice between Tylenol and Advil, the safer long-term pick is usually acetaminophen, unless you have liver issues. NSAIDs can be stronger, but their risks are higher. What about aspirin? Aspirin is technically another NSAID, but it works differently on the body. It prevents blood platelets from clumping, which is why it's often used to reduce the risk of heart attack or stroke. For decades, doctors advise healthy older adults to take a daily baby aspirin as prevention. But newer research found the risk of internal bleeding was actually greater than the benefit for most people who never had a heart attack or stroke. That's why baby aspirin is no longer recommended for primary prevention, meaning people who've never had heart disease. It may still be used for secondary prevention if someone has already had a stroke or heart attack. But for pain, aspirin is no longer the go-to choice. Have you ever seen those PM versions of pain relievers? Tylenol PM, Advil PM? They sound helpful, but here's something important to know. These products usually contain diphenhydramine, better known as Benadryl. It makes you sleepy, but it also blocks a brain chemical called acetylcholine, critical for memory and thinking. For aging brains, this can worsen memory problems and increase confusion. If you or someone you love has noticed cognitive changes, those nighttime pills may be part of the problem. Instead of PM painkillers, talk with your doctor about safer sleep strategies. Now let's shift to other options you might see in the drugstore. Topical creams like icy hot, menthol rubs, or capsaicin creams. These work by creating sensations on the skin, cooling, warming, or tingling, that can distract the brain from deeper pain signals. For many older adults, they offer gentle, side effect-free relief. Another modern option people are curious about is CBD or medical cannabis. Some report benefits for pain, anxiety, or sleep, but research is still developing, and products vary in strength and purity. Potential side effects like dizziness, sedation, or confusion raise concerns, especially for older adults at risk of falls. If you explore this route, always discuss it with a trusted healthcare provider and monitor carefully. So, what's the best way forward if you're managing ongoing pain? Think beyond pills. Physical therapy, massage, gentle exercise, and even acupuncture can improve mobility and reduce discomfort. Cognitive approaches like mindfulness or relaxation therapy can also help, since focusing on pain often makes it feel worse. When it comes to chronic pain, the goal is usually not to be 100% pain-free, but to make pain more manageable so you can live life fully and safely. Let's pause for a quick recap. We've learned that acetaminophen is generally the safest long-term pain reliever for seniors, but liver health matters. NSAIDs like ibuprofen and naproxen are stronger, but come with higher risks to the stomach, kidneys, and heart. Aspirin is no longer recommended for daily prevention unless you've already had a heart event. PM versions of painkillers should be avoided because of their brain effects. And non-drug therapies can often make just as big an impact without the risks. If you're finding this video helpful so far, I'd love to gently remind you to subscribe to Calm Health Hub. That way you'll stay connected to future content on supplements, natural remedies, and strategies for vitality, longevity, and healthy aging. Now, one final set of tips before we wrap up. Always let your doctor know if you're using over-the-counter pain medications regularly. Even if they're non-prescription, they can interact with other medications or conditions. And if pain is persistent, don't just mask it. Work with your provider to uncover the underlying cause and explore safer management strategies. Remember, your health is not just about eliminating pain, but about supporting your brain, body, and well-being for the long term. If this conversation helped you feel more confident about managing pain, I invite you to subscribe to Calm Health Hub. Together, we'll continue exploring safe, natural, and effective ways to support your energy, circulation, brain health, and vitality as you age. Thank you so much for being here today, and I look forward to seeing you in the next video.